David, in the interest of time, I'm going to jump ahead to some true or false statements about product quality. So let's jump to this one. True or false? Fed batch systems introduce quality variability due to prolonged holding times and nutrient limitations, whereas the shorter processing times and steady state conditions in continuous environments improve product stability. True or false?
Well, let me correct actually this statement because continuous processing often is longer. There we have longer production times, 20 days, sometimes 30 or even more. But the benefit of continuous processing is that we operate in a semi steady state. So the product quality and the process parameters are much more controlled, and we see a much more stable product quality coming out of your bioreactor. Now, I would say the hold times, I think nowadays we should have done quite some homework to optimize hold times to not have any significant degradation. Holding, long holding times in the downstream definitely is not recommended. So I would say not so much, and I would say even in the fed batch process. For a classical map, I would say the quality concern is not that big. It can become a concern for difficult to express proteins, for fusion molecules or multi-specifics. Definitely there, it would make sense to move over to continuous processing. Just by the nature of the process itself, it's much more likely to get a better product quality.
Yeah, well, that's a beautiful segue into Alejandro's question. Which kind of speaks to what you just discussed, and I'm sure in your travels and consultation, you've formulated some opinion on this that I'm hoping you'll share. What type of therapeutic product has seen the greatest adoption of continuous manufacturing processes, such as complex enzymes, cytokines, mAbs, and for what molecules does it make the most sense? Is there an answer to that question from Alejandro?
Yes, there is. Well, there are several groups that have seen the adoption. I would say if we go back as early to the 1980s, we were running continuous processing, and at least in the upstream. Take products like Rebif or Gonal F, they are produced, or I think even Factor 8, they're produced in a continuous mode. So those not so stable molecules are produced in, or have been produced for many years now in a perfusion process. And now more recently with the new type of perfusion, to my understanding, it's the main molecules are MAPs, because these are the ones that we understand. We have a lot of experience with that, but now it's not limited to other. We can definitely expand that. But to my understanding, and also the people I talk to, but forgive me, it's not backed up by statistical analysis, but that's my impression that right now we see a lot of MAPs in continuous manufacturing processes.
Yeah. Okay, so this one's this true or false statement's a blanket one. I'll be interested in your opinion on the expectation, true or false, the expectation of continuous and flawless operation for weeks or months is untenable. Inline verification is still evolving, so quality remains a big concern. True or false?
Well, I would say it's false, because we have done a lot of homework and we are able now to run for several weeks. And I would say the biggest concern probably today is the connection between the up and downstream. That's still something we have to learn to manage. Sometimes it's just by using a break tank between the two, but definitely when it comes to perfusion, I would say it's false. We have now the technology to run perfusion runs for an extended period of time. The question is whether we want to take the risk or not.